Good day, sir. I'm Nina Alexia Piclaro, a student nurse from St. Paul University. How are you today po?
I'm good.
Okay, sir. So for today's assessment is I'm going to assess your musculoskeletal system. And for me to be able to do it properly, I'll be going to inspect and palpate some parts of your body. Is that okay with you?
Yes.
Okay, so may I check your ID band, sir? Can you please state your name?
My name is Franzel Don Sirobles.
And how about your birthday?
February 1991.
Okay, sir. Okay, next is I'm going to perform a medical asepsis. Close the curtains for the client's privacy. Next is to gather all the requisites and equipment that is needed in the assessment. I have here with me my tape measure. So for the first assessment is I'm going to assess your gait. And the first thing that I'm going to do is to observe your gait as you enter and walk around inside this room. So sir, can you please stand up? And I want you to walk around this room forward and backward. Backward and backward. Okay, sir. So, stop. Sit down na, sir. Okay, so based on my observation, the posture of the patient is normal. And the way he swings his hands as he walks by is normal. And the base of support, weight-bearing stability of the patient is normal. So everything about the gait, the patient's gait is normal. So next, sir, is I'm going to assess your risk of falling backward. So sir, can you please stand up again? Nabito lang kita. Ano yun? Okay, sir. So, we're done. So, upon observation, I observed that he can support his body as I push him, which is very good and normal. Okay, so for the next assessment is I'm going to assess the temporomandibular joint of the patient. The first thing that I'm going to do is to inspect his TMJ using my index and middle finger. Sir, can you please open your mouth widely? Close. Open. Move it to side. Okay, close. So based on my observation, the temporomandibular joint of the patient moves normally, which is very good. Next is I'm going to test the range of motion of the temporomandibular joint of the patient. So sir, can you please open your mouth again? Close, pinch, deep. Okay. So for the range of motion of the temporomandibular joint of the patient, everything was normal. Next is I'm going to inspect and assess the sternoclavicular joint of the patient. Okay, so as I inspect the sternoclavicular joint of the patient, everything was normal. There is no swelling and the color is normal. And for the location, it is in the midline, which is normal. Next is I'm going to observe, inspect, and palpate the lumbar spine of the patient. So sir, can you please stand up? Straight your body. So based on my observation, the symmetry of the spine of the patient is straight and it is normal. Next is I'm going to palpate the spinous process and the paravertebral muscles in both sides of the spine. Sir, as I palpate, just say yes if you feel any pain, okay? Do you feel any pain, sir?
None.
Okay, so upon palpation, the patient didn't felt any pain, so everything was normal. Okay. Okay, sir, you can sit down again. Okay, so next is I'm going to test the range of motion of the cervical spine of the patient. Sir, can you please use your chin to touch your chest? Okay. And to look up at the ceiling for hypertension. Okay, sir, lower. Next is to move your ear down to your shoulder. Other side. Okay. So, next is to rotate your head left to right. Okay. So next is we are going to repeat everything what we did. Kindly use your chin to touch your chest again. Ear to shoulder. Look up. Turn your head left to right. Okay. As we will be testing the range of motion of the thoracic and lumbar spine of the patient. So sir, kindly stand up again. Kindly bend your body forward and touch your toes. Okay, so next sir, can you please stand up properly again and straight out your body so that I'll be able to observe the symmetry of your shoulders. So next sir is I'll be stabilizing your pelvis. So can you please move your body side to side? Okay. Forward, backward, and rotate your shoulders slowly. Okay, so next sir is I'll be testing your leg and back pain. So can you please lie down at the bed? Do you feel any pain, sir? How about you, sir? Okay, so next is I'm going to measure the legs of the patient. Okay, so for the measurement is both legs has the same measure, so everything was normal. So sir, can you please raise your legs independently and alternately? Okay, so at the other side. So based on my observation, the patient performed very well and he didn't felt any pain as I lift his both legs, and the length of the both legs of the patient has the same measurement, so everything was normal for the thoracic and lumbar spine of the patient. Next is I'll be inspecting and observe the shoulders, elbows, and arms of the patient anteriorly and posteriorly. Sir, can you please sit down? Okay, so for the shoulders, elbows, and arms of the patient is the color is normally brown, which is matched to his skin tone. And for the symmetry, everything was normal, and I didn't see any swelling and masses. Next, sir, is I'm going to palpate and inspect posteriorly. So can you please stand up? Okay, so we're done. Next is for the posterior part, it is warm to touch, and also I didn't felt any tenderness and swelling to the patient's body. Next is I'm going to test the range of motion. So sir, can you please stand up again? Put both arms at the side. Sir, next is can you please move your arms forward? For flexion, then backward with elbow straight. Then next sir is bring your hands together overhead. Straight in the midline. Okay, next sir is bring your hands together behind your head. Okay, repeat. Repeat natin sir, both hands at the side. Forward, backward, overhead. Okay. So, everything was normal for the shoulders, elbows, and arms of the patient.